HIV and AIDS. What is HIV? Hello friends, today we are going to talk about the very dangerous disease that is HIV and AIDS. HIV is a virus that damages the immune system. The immune system helps the body fight off infections. Untreated HIV infects and kills CD4 cells, which are a type of immune cell called T cells. Over time, as HIV kills more CD4 cells, the body is more likely to get various types of infections and cancers. HIV is transmitted through bodily fluids that include blood, semen, vaginal and rectal fluids, breast milk. The virus doesn't spread in air or water, or through casual contact. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one health care. Please also like, share and leave a comment below. What is AIDS? AIDS is a disease that can develop in people with HIV. It's the most advanced stage of HIV. But just because a person has HIV doesn't mean they'll develop AIDS. HIV kills CD4 cells. Healthy adults generally have a CD4 count of 500 to 1,500 per cubic millimeter. A person with HIV whose CD4 count falls below 200 per cubic millimeter will be diagnosed with AIDS. A person can also be diagnosed with AIDS if they have HIV and develop an opportunistic infection or cancer that's rare in people who don't have HIV. An opportunistic infection, such as pneumonia, is one that takes advantage of a unique situation, such as HIV. HIV and AIDS, what's the connection? To develop AIDS, a person has to have contracted HIV. But having HIV doesn't necessarily mean that someone will develop AIDS. Cases of HIV progress through 3 stages. Stage 1, acute stage, the first few weeks after transmission. Stage 2, clinical latency, or chronic stage. Stage 3, AIDS. As HIV lowers the CD4 cell count, the immune system weakens. A typical adult's CD4 count is 500 to 1,500 per cubic millimeter. A person with a count below 200 is considered to have AIDS. How quickly a case of HIV progresses through the chronic stage varies significantly from person to person. Without treatment, it can last up to a decade before advancing to AIDS. With treatment, it can last indefinitely. HIV transmission, know the facts. Anyone can contract HIV. The virus is transmitted in bodily fluids that include blood, semen, vaginal and rectal fluids, breast milk. Some of the ways HIV is spread from person to person include through vaginal or anal sex, the most common route of transmission, especially among men who have sex with men. By sharing needles, syringes, and other items for injection and drug use. By sharing tattoo equipment without sterilizing it between uses. During pregnancy, labor, or delivery from the womb to her baby. During breastfeeding. Through pre-mastication, or chewing a baby's food before feeding it to them. Through exposure to the blood of someone living with HIV, such as through a needle stick. Causes of HIV. HIV is a variation of a virus that infects African chimpanzees. Scientists suspect the simian immunodeficiency virus, SIV, jumped from chimps to humans when people consumed infected chimpanzee meat. Once inside the human population, the virus mutated into what we now know as HIV. This likely occurred as long ago as the 1920s. HIV spread from person to person throughout Africa over the course of several decades. Eventually, the virus migrated to other parts of the world. Scientists first discovered HIV in a human blood sample in 1959. It's thought that HIV has existed in the United States since the 1970s, but it didn't start to hit public consciousness until the 1980s. Causes of AIDS. AIDS is caused by HIV. A person can't get AIDS if they haven't contracted HIV. Healthy individuals have a CD4 count of 500 to 1,500 per cubic millimeter. Without treatment, HIV continues to multiply and destroy CD4 cells. If a person's CD4 count falls below 200, they have AIDS. Also, If someone with HIV develops an opportunistic infection associated with HIV, they can still be diagnosed with AIDS, even if their CD4 count is above 200. What tests are used to diagnose HIV? Several different tests can be used to diagnose HIV. Healthcare providers determine which test is best for each person. Antigen tests. Antibody tests. Nucleic acid test, NAT. What's the HIV window period? As soon as someone contracts HIV, it starts to reproduce in their body. The person's immune system reacts to the antigens, parts of the virus, by producing antibodies, cells that fight the virus. The time between exposure to HIV and when it becomes detectable in their blood is called the HIV window period. Most people develop detectable HIV antibodies within 23 to 90 days after infection. If a person takes an HIV test during the window period, it's likely they'll receive a negative result. However, they can still transmit the virus to others during this time. If someone thinks they may have been exposed to HIV but tested negative during this time, they should repeat the test in a few months to confirm. The timing depends on the test used. And during that time, they need to use condoms to prevent possibly spreading HIV. Early symptoms of HIV. The first few weeks after someone contracts HIV is called the acute infection stage. During this time, the virus reproduces rapidly. The person's immune system responds by producing HIV antibodies. These are proteins that fight infection. Early symptoms of HIV can include fever, chills, swollen lymph nodes, general aches and pains, skin rash, sore throat, headache, nausea, upset stomach. What are the symptoms of AIDS? AIDS refers to acquired immunodeficiency syndrome. With this condition, the immune system is weakened due to HIV that's typically gone untreated for many years. If HIV is found and treated early with antiretroviral therapy, a person will usually not develop AIDS. Symptoms of AIDS can include recurrent fever, chronic swollen lymph glands, especially of the armpits, neck, and groin, chronic fatigue, night sweats, dark splotches under the skin or inside the mouth, nose, or eyelids, sores, spots, or lesions of the mouth and tongue, genitals, or anus, bumps, lesions, or rashes of the skin, recurrent or chronic diarrhea, rapid weight loss, neurologic problems such as trouble concentrating, memory loss, and confusion, anxiety and depression. Treatment options for HIV. Treatment should begin as soon as possible after a diagnosis of HIV, regardless of viral load. The main treatment for HIV is antiretroviral therapy, a combination of daily medications that stop the virus from reproducing. This helps protect CD4 cells, keeping the immune system strong enough to fight off disease. Antiretroviral therapy helps keep HIV from progressing to AIDS. It also helps reduce the risk of transmitting HIV to others. When treatment is effective, the viral load will be undetectable. The person still has HIV, but the virus is not visible in test results. However, the virus is still in the body. And if that person stops taking antiretroviral therapy, the viral load will increase again and the HIV can again start attacking CD4 cells. HIV prevention. Although many researchers are working to develop one, there's currently no vaccine available to prevent the transmission of HIV. However, taking certain steps can help prevent the spread of HIV. Get tested for HIV. Get tested for other sexually transmitted infections, STIs. Use condoms. Limit their sexual partners. Take their medications as directed if they have HIV. Avoid sharing needles or other drug paraphernalia. Consider PEP. Consider PrEP. Is there a vaccine for HIV? Currently, there are no vaccines to prevent or treat HIV. Research and testing on experimental vaccines are ongoing, but none are close to being approved for general use. HIV is a complicated virus. It mutates, changes, rapidly and is often able to fend off immune system responses. Only a small number of people who have HIV develop broadly neutralizing antibodies, the kind of antibodies that can fight a range of HIV strains. HIV statistics. In 2016, about 36.7 million people worldwide were living with HIV. Of those, 2.1 million were children below the age of 15. In 2017, only 20.9 million people living with HIV were using antiretroviral therapy. Since the pandemic began, 76.1 million people have contracted HIV, and AIDS-related complications have claimed 35 million lives. In 2016, 1 million people died from AIDS-related diseases. This is a decline from 1.9 million in 2005. Eastern and Southern Africa are hardest hit. In 2016, 19.4 million people in these areas were living with HIV, and 790,000 more contracted the virus. The region has more than half of all people living with HIV worldwide. Every 9.5 minutes, someone in the United States contracts the virus. That's more than 56,000 new cases a year. It's estimated that 1.1 million Americans are currently living with HIV, and 1 in 5 don't know that they have it. About 180,000 American women are living with HIV. In the United States, almost half of all new cases occur in African Americans. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below.